Okay, so you want to know what the top Medicare drug plans are for 2023. Now, it could be October of 2022, it could be November, December of 2022, or it could be the year of 2023. This is going to be good for the whole year of 2023. But if you're looking at this because of open enrollment, which is October 15th, 2022 until December 7th, 2022, this is good for that also. I want to show you how to go through. Now, some of you might be wondering, hey, I just want to know what the top plans are. Just give it to me. Well, I can tell you right now. The problem with just handing out the top prescription drug plans, I can say, hey, there's SilverScript, there's WellCare, there's, Aetna or Cigna's plan. I mean, there's a ton of prescription drug plans in your area. The problem with this is it's all individual, meaning somebody who takes levothyroxine and another person takes, some other drug, atorvastatin or whatever. Everyone takes different drugs. So the drug plans aren't, you have to punch in your drugs to figure out which the best plan is for you. Now, some of you might be wondering, well, hey, I tried to call my agent, but he's not getting back to me, or nobody wants to help me with my drug plan. I can tell you right now, if you have an agent that has your Medicare supplement plan, aka your Medigap Plan G or whatever it is, and you try to call another agent and you say, hey, I just want my drug plan done. My med sup is with this other guy. Most people, maybe they'll do it. Most people that they don't want to do it. They're not, the drug plans are a nightmare. You're not going to make any money on it. So most people will not do that. But hey, maybe your agent is picking up the phone and he can take care of you. Or maybe you just want to do it on your own. So I'm going to give you a tutorial on how to do it. So first you have to go to Medicare.gov. So let's punch that in. Now, hopefully it's not too loud here. So Medicare.gov, you punch that in. The next thing you're going to do, you're going to see this guy with the hat on. It's going to say open enrollment starts October 15th. Now, I'm making this video October 13th. Remember, this is good for a year. So if you're watching this in 2023, keep watching. So now we're going to do this find health and drug plans. So right here, underneath this guy with the hat on, you're going to click on find plans now. Now you're going to put in whatever zip code you live in. So let's just put in, I'm not going to put in my zip code, but I'm going to put in an old zip code that I used to live in, 19468. And this is for 2023. Now, if you're watching this in 2022, just starting Medicare, you can use this also, but just click 2022. If you want this for starting January 1st, obviously, open enrollment, you're going to click 2023. Then you're going to select plan type right here. You're going to just select drug plan. Even if you want to look at Medigap plans or Medicare Advantage plans, don't do it in the same thing. Separate it. So just hit drug plan. Hit apply. Then you're going to hit start right here, center of the page. Now, I always write, I don't get help from any of these programs when it comes to this page, help with your costs. Do you get help with your costs from one of these programs? Now, if you're on Medicaid or something like that, that's a whole different ballgame. I always click, I do not get help. I don't click, I'm not sure, because they might give you information you don't need. So hit, I don't get help from any of these programs. Hit next. Tell us your search preferences. Do you want to see your drug cost when you compare plans? Yes, that's the only thing we want to see is the drug cost. So we hit yes, and it says great. Then we hit next again. This is pretty simple. So look, I'm going to punch in a couple of the top drugs that are out there where pretty much a lot of people take. So people take thyroid medication, they take cholesterol, they take blood pressure. This is almost every senior that I've talked to. Not almost every, but 90% of them take blood pressure, thyroid, or a statin drug. So let's punch in atorvastatin. Well, let's put in atorvastatin. See how it pops right up on the screen after I put in a couple of letters. So you'll just click on the atorvastatin if that's what you take. Then you'll click add drug right here. It will go to the next page which says the dosage. You can click on this arrow right here. It'll say 10 milligrams, 20 milligrams. Then it's the quantity, 30 every month. That would be 1 pill a day, obviously. Stay with me here. I hope this isn't boring you. So add to my drug list is what you're going to hit to add this drug. Bang, there it is. Now you can always go back to this and edit the drug or remove the drug. So sometimes I'm talking to a client and I'm going through this to look up their drugs. They say, "Oh, it's not a atorvastatin. I forgot it's Lipitor," or whatever it may be. They switch the drug, they forget what it is, or they don't take it anymore, so they have to edit or remove the drug. So here's one. Let's add another one. Let's put in lisinopril. That's a popular drug. Lisinopril is right here. Add drug. Look at the milligrams. We'll say 30 milligrams and then once a day. Or let's say you take, every 2 months, every 3 months, whatever it may be. We'll put it in every 3 months. Why not? Add to my drug list. Once again, you're going to put that in there. So now we have 2. I'm going to put 3 drugs in here because this is a fun day. So let's add another drug right here. So what did I say? No, we put blood pressure. Oh, levothyroxine. Let's do a thyroid drug. So I put in Levoth, and here we are, levothyroxine sodium. Now, really look at the bottle for your prescriptions, because you don't want to think that you take, like Synthroid or something like that, and really you take levothyroxine. You don't want to put in the brand, because that's going to show your cost if you take the generic. Same thing, you don't want to put in the generic if you take the brand. So you add the drug, ask for the dosage, we'll just leave it where it is, and add my drug to the list. Now I have the 3 drugs that I take, supposedly. I don't take any of these, but done adding drugs is the next thing. I'm done with this, so I'm going to hit done adding drugs. It's going to say find my pharmacy. Now, it has my zip code in there, which is my old zip code. And then I can punch in a name of a pharmacy here and hit find pharmacy. But usually I go down, and most of the time I'm talking to someone on the phone and I'm doing this. So I always hit mail order. I just always do that. And then I look for, if they say I go to Rite Aid, I'll click that. Or if they say I go to CVS, I'll click that. Sometimes maybe they won't tell me, or maybe they say, hey, can you check my drugs? They'll email the drugs, and I'll just say, well, most likely they go to CVS, Giant, which is a grocery store, or Rite Aid or something, and I'll just put those in. So then at the bottom here, you'll see, let's get rid of this. At the bottom, you'll see the pharmacies, and I'll click done right here, all the way to the right at the bottom. Hopefully my picture isn't there as I'm doing this video. Now it comes to the page which shows the prescription drug plans. Now I can tell you right now, a lot of my clients have SilverScript Smart Saver. The reason being is, once again, this showed up because it sorts the plans by lowest drug and premium cost. Now what that means is there's a premium for the plan, which is $5.20 for this SilverScript, which is owned by Aetna, which is owned by CVS. $5.20. This is the lowest premium cost. This plan, that's what you're going to pay the plan each month just to have the plan. So you're going to send $5.20 to Aetna or SilverScript. Then on top of that, you're going to look at your yearly drug cost is going to be $119. So this times 12, 5 times 12 plus the 20 cents is it probably is like $62 or whatever for the year. That's what you'll pay Aetna. And then your yearly drug cost is going to be $119. That's going to be copays or deductible, or part of this deductible. Not bad, pretty cheap for 3 drugs all year long, $120. But we're going to compare some of these drug plans. So we can either look at the plan details right here, and you click on, remember, open enrollment starts October 15th. But if you're first going on Medicare, you need a drug plan that month. So you don't do it just during the open enrollment period. You might do it in March because you're first going on Medicare. Plan details right here. If you click on that, it's going to show you this plan and this plan only. And it will have the non-member phone number. If you're not a member, that's what you're going to call. If you're a member, you call this. That's if you want to sign up for the plan over the phone. Usually they'll have a button here that says enroll somewhere. Now, you can go down and scroll to say $5.20, blah, blah, blah. It'll tell you in-network preferred. Now, CVS owns Aetna, which owns SilverScript, so obviously that's going to be your preferred pharmacy, which means it's going to be cheaper. So look at this, atorvastatin and Rite Aid with SilverScript. Now, with another plan, it might be cheaper. But for the year, it's going to be $24 at CVS. Look at all these giant $228, and $22 for mail order. You might want to look at mail order, of course. Now, levothyroxine, $24 for the year. So that's $2 a month it's going to cost you. And then lisinopril, $9. Now, your total yearly drug cost is going to be $57 for the total of this. So total yearly drug plus premium. I'm sorry, you don't add the $60 to the $120. That's what it is. So it's going to be $120 total for your drugs. Let's just scroll down a little bit. It shows you the month. Now, the reason why it shows you the month is because it changes from different months. $6.27, then it goes to $4. So, I know why it changes, because we put in that we don't take the one drug every month. So this is going to show you some of the drugs you only take once a year, something like that. This will show you the exact amount each month. Where this might change is some of you might hit the donut hole. That's going to show that. You might say, wow, it was this, and then all of a sudden it's $400 and something. That's because you hit the donut hole and it's going to cost you more. Let's scroll up quickly and let's hit the back button. Back to search results right here up in the left. Hopefully you can see that. You click on that right above SilverScript Smart Saver, and it goes back, loads up, and then you see all the different plans. Now, WellCare right here is also a popular plan. It's popular because a lot of people take generics, and if you're taking a couple of generics, this is what you're going to see most likely. SilverScript, WellCare, whatever it may be. Cigna, Saver. So let's compare these three. You click on Add to Compare, which is right next to each plan's details. There's three of them. I just clicked on them. If you notice at the bottom of the screen, there's the plans. And I'm going to take my cursor, click on Compare, and it's going to show me that the three of them across. So SilverScript, I'm paying them $5 a month, $5.20. WellCare, I'm going to pay them $11.10. This doesn't change. You're going to pay that to the plan to have the plan. But if we scroll down, we're going to see, okay, they all have the same deductible. Deductible is just what you pay first before the plan starts kicking in, basically. And some of them, you want a high deductible because the drugs are cheap. Now look at this. Obviously, CVS with SilverScript is going to be cheap, but then it's different with different plans. Look at this CVS for Cigna Saver. The plan is only, $7 more a month, but this CVS is $436 compared to $120. So this is going to be, this is where I go to my pharmacy and so forth. You're going to look at this page and say, okay, obviously the SilverScript is the one for me, if these are the drugs that you're taking. Depends on the drugs. Then you're going to say, okay, I see, I'm not going to Rite Aid. That's expensive. I'm not going to Giant. This is where I want to go is CVS. Let's click on the plan details, and you go back to the plan details, and that's what I showed you before. And you can dissect this. Now, like I said, starting in a couple days, there should be a click to enroll button right over here or somewhere on this page. You will click and you can enroll right online. Now, if you're scared to do this, I completely understand. You don't want to screw things up. You can always call someone to help you do this. And if it's really bad, like I said, you can call the company directly, non-members, right up here, and ask them all the questions that you want. Just hope the phone lines aren't busy all the time. But hey, you have until December 7th. I can tell you right now, October's a nightmare. There's so many people trying to get in because everyone wants to get it over with. So if you call like the end of November, it most likely, I would call in October, but then try the November also. It'll probably get easier and easier. I hope this helped everybody out there. Like I said, I can't give you the top companies, like the thumbnail said, unless I see your drugs. And if I had to do everyone's drug plan who came here and watched the video, then I'd be doing 10,000 drug plans, over the course of 5 years probably, or something like that. Depends on how many people call me, but it would be unbearable between these 2 months. So it's great for people to know how to do this themselves, even if they want to use a broker to or an agent to do this for them. At least you see what the best plan is for you. Thanks for watching this video. I'll see you at the next one. Oh, real quick. There's a link in the description. You might want to click that to another video. And also subscribe to the channel so that you can see other Medicare videos as well as Social Security videos and so forth. Take care.